In America, getting sick can feel like a financial emergency. Even with insurance, people are drowning in medical bills or skipping their doctor visits or rationing out their medication. But here's something interesting. Every other wealthy country has figured out a way to cover everyone, and they actually spend less money doing it. Let's imagine what would happen if the United States made healthcare universal. Universal healthcare means everyone's covered, no matter their income, job, or health status. You can see a doctor when you need to, and you don't lose coverage if you change jobs, if you move, or get sick. And that doesn't necessarily mean government doctors. It just means the financing is handled collectively, kind of like how we all chip in for public schools or roads or fire departments. Right now, we waste an enormous amount of money on paperwork and insurance bureaucracy. In fact, about a quarter to a third of all healthcare spending in the U.S. goes towards these administrative costs, not actual medical care. That's billions of dollars on billing departments, claim denials, and middlemen. With universal health care, that gets simplified. One streamlined system, less paperwork, and the power to negotiate lower prices for medicine and hospital services, just like other countries do. So yes, it might raise your taxes, but you'd likely pay less overall because you'd no longer be paying sky-high premiums, deductibles, or surprise bills. When everyone has access to healthcare, people tend to catch their problems earlier instead of waiting until their emergencies. That means fewer expensive hospital stays and a healthier population overall. Countries with universal healthcare, like Canada, Japan, or Germany, have longer life expectancy and lower infant mortality than we do here in the States. And here's the best part. When the government has to pay the healthcare bill, it suddenly has a big incentive to keep people healthy. So that means they're going to invest in cleaner food, safer neighborhoods, mental health, and preventative care, including educating and motivating their own citizens to stay healthy. Now, universal health care isn't just a magic fix. Transitioning would be messy and expensive at first. The government would have to rebuild the system, retrain workers, and rework taxes. Wait times, they could temporarily get longer as more people start going to the doctor. And yes, some people worry that government involvement would mean more bureaucracy or slower innovation. But those already exist today, just in hands of private holders. And here's the part people often miss. Not every country with universal health care uses a single government plan. Many have hybrid systems. This combines public coverage with options for private insurance. Take Germany. There, everyone has to have health care, but you can choose between public and private nonprofit plans. Or in Japan, local communities and employers run their own health societies under national rules. These systems give people the freedom of choice. It keeps competition alive. It still covers everyone, and for a lot less money than what we spend. It's universal care without losing the flexibility that we as Americans really enjoy. So what would universal health care mean for America? Lower costs overall, better access for everyone, a healthier population, and a government finally motivated to keep us well, not just treat us when we're sick. Now, the drawbacks are real, but so are the lives, money, and peace of mind that we could gain. In the end, it's not just about healthcare. It's about what kind of society we want to be. One that treats health as a privilege, or one that sees it as a shared foundation for a stronger nation. Maybe the real question isn't, can we afford universal health care? It's, can we afford not to?